So, today we're going to be talking about heart failure, which is a progressive disease characterized by myocardial cell dysfunction, resulting in the inability of the heart to pump enough cardiac output in order to meet the demands of the body. And this is going to result in intravascular and interstitial volume overload and poor tissue perfusion. The signs and symptoms of heart failure can be divided into left-sided or right-sided heart failure. Left-sided heart failure is the result of backflow of blood that causes fluid accumulation around the lungs. So some signs of this include shortness of breath, crackles on auscultation, fatigue, weak pulses, or cool temperature in the extremities. Right-sided heart failure is the result of backflow of blood into the right atrium and venous circulation. So they're going to have signs like jugular vein distension, edema, ascites, or hepatomegaly. Some of the risk factors for developing heart failure include a family history, high blood pressure, diabetes, or obesity. Diagnosis of heart failure is primarily based on the patient's history, their physical assessment, as well as lab values. The lab values will show an increased BNP level, which is a result of overstretching of the ventricles. It could also show elevated BUN or creatinine, which could indicate pre-renal failure or overdiuresis, because this patient is going to be on furosemide or another diuretic to decrease the intravascular volume. You may also notice lower levels of hemoglobin or hematocrit or elevated hepatic enzymes. Some of the common medications to treat heart failure include ACE inhibitors such as lisinopril or enalapril, and these work to reduce the afterload, which means they reduce the resistance in the vasculature. Diuretics may also be given, or digoxin, to slow the conduction and strengthen the contractions of the heart. Some of the complications associated with heart failure include biventricular heart failure, and this is when both sides of the heart are starting to fail. So this patient is going to have both left-sided and right-sided symptoms and severe cardiac compromise. Another complication is pulmonary edema, and this is rapid accumulation of fluid around the lungs, which places more pressure on the heart. And they may also develop renal failure due to the decrease in blood flow to the kidneys. Some of the main nursing interventions include administering their medications and oxygen. This patient could be short of breath, or their heart isn't getting the oxygen that it needs. So applying oxygen via a nasal cannula could definitely help in their plan of care. You also want to make sure that you're getting a daily weight on this patient because they're so prone to fluid volume overload. And we want to make sure that their weight is staying at a consistent number every day. And it's also really important to enforce fluid and sodium restrictions because sodium can cause the patient to retain even more fluid. Some of the important information to go over with the patient are symptoms to monitor for, such as edema, shortness of breath, or fatigue, as these could indicate worsening heart failure. So if they develop anything like that, then they definitely want to call their doctor. And also you want to encourage them to alternate rest and activity periods.